Time is precious, and so are our pets. So time with our pets is extra precious. That's why we started Dutch. Dutch provides 24/7 access to licensed vets, with unlimited virtual visits and follow-ups for up to 5 pets. You can message a vet at any time and schedule a video visit the same day. Our vets can even prescribe medication for many ailments, and shipping is always free. With Dutch, you'll get more time with your pets and year-round peace of mind when it comes to their vet care.
Hey, it's another great birth story episode. Welcome to the All About Pregnancy and Birth podcast. I'm Dr. Nicole Calloway Rankins, a board-certified OBGYN who's been in practice for nearly 15 years. I've had the privilege of helping over 1,000 babies into this world, and I'm here to help you be calm, confident, and empowered to have a beautiful pregnancy and birth. Quick note, this podcast is for educational purposes only and is not a substitute for medical advice. Check out the full disclaimer at drnicolerankins.com/disclaimer. Now let's get to it. Hey, quick note before the episode. If you've been listening and thinking, okay, but how do I actually get ready for birth? I've got something coming for you. It's the Birth with Power Pathway, and it's my new updated online birth course launching this May. I'll walk you through a step-by-step plan to get you calm, confident, and empowered. Get on my email list at drnicolerankins.com/email so you don't miss it. Hello. Welcome to another episode of the podcast. This is episode number 132. Thank you for being here with me today. In today's birth story episode, we have Alex. Alex is 30 years old. She had her baby girl in March of this year. She's been married for 4 years, and they live in the mountains of Colorado. She is an oncology pharmacist at her local cancer center, and she likes to hike, ski, and travel. Alex joins us to share her experience of having a miscarriage with her first pregnancy at around 11 weeks. She then got pregnant fairly quickly thereafter, about 3 months later. That pregnancy was pretty uneventful until about 34 weeks when she started to have really bad itching, and she was diagnosed with something called cholestasis of pregnancy, and you're going to learn what that is in the episode. She ultimately was induced because of the cholestasis, and she's going to share how she managed her labor induction without an epidural. She's also going to talk about her postpartum recovery and some challenges that she had there. As always, this is an amazing birth story episode. I know that you are going to enjoy it and learn a lot. Now, before we hop into the episode, let's do a quick listener shout out. This is from I'm just going to spell it, RACIZME. And she left me this review in Apple Podcast. And the title of the review says informative and hopeful. I've been listening to this podcast on and off since my first pregnancy about a year ago. I'm now on my third after 2 early miscarriages, and while I've needed to take breaks for my own mental sanity, I've found this podcast to be comforting, hopeful, and more than anything, informative. I adore listening to the birth stories with real perspectives, the good and the bad, loss, and ultimately triumph. Dr. Rankins has such a calming, comforting demeanor, and you just feel how she cares so deeply about the process and about guiding each woman through a successful pregnancy journey. I can't wait to dive deeper into her resources and practice these topics in my own pregnancy, praying that I will have a successful pregnancy this time around. Well, I too am praying that you have a successful pregnancy. I am wishing you the absolute best, and I so appreciate you taking the time to leave me that lovely and kind review. Now, speaking of the resources I provide, I have created a new resource. It is a fun, quick quiz to help you assess where you are in terms of your knowledge about managing pain in labor and the options for managing pain in labor. It's super quick, super fun. You'll definitely learn something just by going through it. You can check it out at drnicolerankins.com/quiz. It's called the Labor Pain Quiz, and the link to that is in the website notes and also in the podcast show notes. All right, let's hop into the episode, Birth Story with Alex. thank you so much, Alex, for agreeing to come onto the podcast. I'm so excited to have you come on and share your birth story.
Thank you so much for having me. I'm excited to be able to share.
Yeah. So why don't you tell us a little bit about yourself and your work? Because I think that is important to your pregnancy as well, and your family, if you'd like.
So I live in the mountains in Colorado with my husband, who is a firefighter, and our now 3.5-month-old baby girl, Sloan, and a huge 5-year-old golden retriever named Benjamin. And I am a pharmacist that specializes in cancer care and chemotherapy.
Okay. So yeah, we're going to talk about how that impacted, because I'm sure you work with some potentially dangerous medications in the sense that they affect pregnancy. I'm jealous that you live in the mountains. I love the mountains of Virginia, so I'm sure it's beautiful where you are.
It is definitely fantastic. It was hard for me this year not to be able to ski this winter, because that's been a huge part of my life since I was very, very little.
Right. Well, if your baby is 3 months old, then yeah, you were definitely very much so pregnant in the middle of the winter.
Oh, very much so.
Yeah, with all of the things going on. So, all right. So why don't we have you tell us about, because in order to understand birth, we have to understand a bit what the pregnancy was like. So what was your pregnancy and prenatal care like?
Sure. So I was pretty fortunate to be able to receive all of my prenatal care and actually deliver in the hospital that I work for. So that was pretty undoubtedly convenient, but also reassuring, that my care team was literally in the same building as me. But the OBGYN group there is a combined physician and midwife practice. So they do cycle you through all of the providers throughout your prenatal appointments. And I was able to meet and work with most of them. Of course, the woman that ended up delivering my baby, I had never met, but she was still fantastic. I do think, like, just sort of reflecting on that I do think I would have preferred maybe just a single provider instead of being circled through, just for continuity and consistency of care. It did seem like they all had, kind of slightly differing opinions about symptoms and issues. But overall, I was pretty happy with my care. And then as far as how my pregnancy went, I actually initially found out that I was pregnant in early January of 2020. And at around 7 weeks started spotting pretty heavily. Went in for an ultrasound. They did see a fetal pull and just a little flicker of a heartbeat. But my HCG levels and progesterone levels were very, very low. So they at that point called it a threatened miscarriage. Brought me in 3 weeks later, and of course didn't see a heartbeat. Baby was only measuring at 8 weeks at that time. So they did diagnose me with a missed miscarriage. The physician recommended against a DNC. So I did do the mifepristone and misoprostol drug protocol to just sort of help pass those retained products of conception, I think they call it. Yeah. And that was, obviously very just rough and intense, but thankfully effective. And I was able to get pregnant 4 months after that. So didn't have to wait very long, which was great. And my second pregnancy was largely uneventful, kind of until the very end of my third trimester. So pretty thankful for that.
Nice.
Yeah.
Well, good. I know it can be like, for some people, like, really, like you said, find it really reassuring that they give birth at the place where they work. Some people are like, dang, I wish I could go someplace else. So I'm glad that you were able to find that it was a good fit for you. And I can totally see, especially if there's like 7 or 8 doctors in the group, which doctors tend to be like that, you really don't get a connection with anybody.
Exactly.
Yeah. And you almost wonder, is it better to like see somebody regular and develop that connection during pregnancy and then prepare for the possibility that, whoever's there, you may not know, because it's likely even if you meet everyone once, you just don't have that ability to connect. So that's certainly something to think about. And I'm also curious, like, interesting that your doctor recommended against the DNC. What was usually we presented as an option? Were they just like, it wasn't necessary, or doing the surgery? I'm curious.
Well, it was presented as an option, but he talked quite a bit about scar tissue and that if I wanted to get pregnant after that, I might have more success, I guess, doing the drug protocol instead of a DNC. And maybe it was just his preference. I really am not sure.
Sure.
The exact reason.
Yeah. I mean, I think often very early, I tend to lean, I'm not in the office anymore, but I think that, for those early pregnancy losses, that combination of medications can work well. It ends up being like a heavy period.
Yep.
Yeah. Well, I'm glad that, your second pregnancy was largely uneventful, until the end, which we'll talk about. So you said that you are an oncology pharmacist, and I'm sure you work with some potentially dangerous medications in the sense that they could have a negative impact on pregnancy. How did you manage that risk?
Yeah. So fortunately, as the pharmacist, I don't have to, prepare the chemotherapy for infusion, and I don't have to administer it. The nurses do that. But I do have this sort of low level risk of exposure just because my office is adjacent to where we mix chemotherapy and where we store chemotherapy. And there's just this potential that chemotherapy can literally like be in the air and it can collect on surfaces. So, the risk that my desk was just sort of covered in these, very small chemotherapy particles was very much a real thing. And there is, documented evidence that people who work with chemotherapy can have negative pregnancy outcomes, mainly trouble getting pregnant, early pregnancy loss, and not a lot of, genetic complications with the fetus, but, definitely just some complications. So I was very worried about it. And thankfully my bosses and my colleagues were incredibly supportive of that, and essentially made it possible where, other than me sitting in my office, I didn't have to touch the drugs. I didn't have to carry the drugs, be around it. I didn't have to, enter patients' rooms where they had just vomited and the vomit could have, potentially have chemotherapy in it, all of those kind of things. And we were able to implement new cleaning procedures, and everyone was just incredibly supportive. So I eventually just felt like my risk was very low, and sort of got through it that way.
Yeah. That's really great that you had a supportive team of folks around you who were willing to help you, because that's scary, and you just don't know. So that's great that you were able to have that support for sure.
Absolutely.
Yeah. So you said your pregnancy was going along well, and then around about 33, 34 weeks, things changed. Tell us what happened with that.
Things did change. I very interestingly just got incredibly itchy, like all over, mainly on like the soles of my feet, and obviously my belly that was, stretching and growing. But went in at 34 weeks, and the provider that I saw suspected cholestasis, which is this interesting, and as I understand it, very rare, but potentially very serious condition that can happen where your bile acids, and you can speak more to this, but that your bile acids accumulate essentially, and they wedge themselves into the little capillaries that are close to your skin, and that makes you itch, but it can also go and seed themselves into the placenta and then cause lower blood flow to the fetus, I think, is if that's correct.
Well, if that's not a perfect explanation, I don't know what is. That was excellent. Yes. And because of that, it increases the risk of stillbirth. So
they had presented to me that, if they diagnose it based on symptoms and then lab tests, and they had said, if your labs come back high, we might need to consider induction at 37 weeks. And so interestingly, my labs came back right at that borderline level. I think it's above 10 where you really worry, and mine were, in the like right around 9. So they opted to just monitor me very closely. I went in every week for a non-stress test. Like they hooked me up to check the baby's heart rate every week. And thankfully all of that was fine. But it never went away. And I was just very, very uncomfortable for those last kind of 4 to 6 weeks of my pregnancy.
Sure. What did you do to try to help with the itching?
Oh my gosh, just, Aveeno baths, and just tried to slather myself in all of the lotion. I took the doxalamine just to try to see if that would help. And it did help me sleep through a lot of the itching, which was good. Right. At one point, they did prescribe me the ursodiol, which can just sort of help break down those little bile acids and maybe help
Right.
you itch a bit less. But I took it for a couple of days and it didn't help. And then I was like, I don't really want to be taking a medication if it's not helping.
Sure.
And so sort of just toughed it out.
Gotcha. Yeah. And I don't know if anybody listening, if you ever had a problem with itching, I have weird sometimes, I've had like hives. I think it's a stress reaction where I will have breaking out in hives and itching. When you have intense itching and it is all over, it is so uncomfortable.
Incredibly miserable and almost painful.
Yes.
Yeah.
Yes.
Like that. It's like burning and pins and needles. And yeah, you just, when you can't get rid of it, it is awful.
Yes. Yes. And to go through it for weeks. So, kudos to you for toughing it out, but it is hard. And then you're taking medications that can make you, like a lot of the antihistamines can make you sleepy.
Yep.
And then you're still trying to work. So, yeah, I'm sorry that you had to have that experience, but guys, let me tell you, although it may sound like, oh, you're itching, it's not that bad. Intense itching can be really, really, really annoying. And interfering with your life. So, all right. So you were dealing with that, and then you kind of knew that you were going to probably have to be induced at some point. What did you do when you knew that was coming? What did you do to prepare for your birth?
I did a lot of things actually to prepare for birth. Initially I, read all the books. I read Expecting Better and I read Ina May's Guide to Childbirth and did all that, listened to some other podcasts, and then found your podcast actually at one point, and it just sort of really resonated with me and clicked with me. And more than anything, I loved hearing birth stories and just hearing what other women went through. And I just thought that was incredibly valuable. And I had it in my head that I didn't necessarily want a fully unmedicated birth, but I did want to do it without an epidural.
Okay.
So tried to kind of focus on birth stories where other women had done that, talked to my friends who had done it without an epidural, just sort of got some advice from them. And that was hugely helpful for me.
Gotcha. So I'm guessing you listen to the Birth Hour podcast. I know lots of folks listen to that when they want to listen to birth stories.
You know what? I heard you reference it a bunch, but you had enough in your armamentarium that I was able to go back all the way to the beginning and listen to essentially all the ones that you had done.
Well, I love it. Thank you. All right. So you wanted to do, low intervention, it sounds like, sure. No epidural for your birth. Anything else that you wanted for your birth?
Not really. I was very open to kind of all of the possibilities and just understood that, things can change so quickly. I just didn't want to be mentally attached to a plan that then would change, that then I might be disappointed in my birth experience.
Sure. Did you ever consider a doula or anything like that?
I didn't, mainly because of COVID. They wouldn't have been allowed in anyway.
Gotcha.
And I have not, medically inclined husband, a very, very supportive husband who just completely followed my lead. And I actually ended up making him a ton of notes, like on a note in his iPhone. So he could have like little things to sort of remember and then encourage me, like all of the ways to breathe and suggest this position and all of that kind of stuff. So I thankfully had a very good support system in him.
Gotcha. And did you just get all your information from books, or did you do a formal childbirth education class at all?
We, again, because of COVID, everything was pretty much shut down to do an in-person class. Yeah. So we did do one online that I thought was kind of helpful. If anything, it was helpful for my husband and I just to like discuss the possibilities and just sort of learn about some techniques for pain management and those kind of things. I didn't think it was hugely helpful, probably because it wasn't in person and it wasn't personalized, anything like that. But it did spark some good discussions.
Gotcha. Okay. So let's talk about what was your labor and birth like?
So, like I said, around 34 weeks, I developed this sort of intense itching, and they were bringing me in every week, obviously just for follow-up, but also for the non-stress. And then they were also checking my cervix every week because I think, the thought of induction seemed like it was always on the table. So they were always sort of checking me to see if I was favorable for induction. And around 35 weeks, I was actually already 4 centimeters dilated, which was just sort of crazy to me.
Yeah.
But so, like I said, they were just suggesting that I sort of tough out the itching, tough out all these terrible Braxton Hicks contractions I was having all of the time. And around 38 weeks at that appointment, I was so uncomfortable. I actually requested that they sweep my membranes,
Gotcha.
Which they did. And at that point, the midwife was like, "You're 4 centimeters. I just swept your membranes. I assume we're going to see you tonight. If not, call us back in 48 hours and we'll discuss a plan." So of course, 48 hours later, I was not in labor. And I was actually at work, called the on-call midwife, and she was like, "Well, run upstairs. I'll see you in L&D triage and we'll come up with a plan." And she, interestingly, unlike some of the other providers I had seen, was very, very worried about the fact that I was still itchy, and essentially said, "I don't really care what your labs are. You're this itchy. I don't even want to flirt with the idea that you have cholestasis. I want to induce you today." And I was like, "Oh, wow. Okay." So, I was like, "Well, can I go back to my office? I've got some emails I need to write. Right. I need to call my husband. We live like an hour away from the hospital." So I was like, "I need to get him here." Right. She's like, "Yeah, sure. Come back in a couple hours." So like 3 hours later, I literally got admitted, and they started Pitocin around 2:00. I was also Group B strep positive. So they started ampicillin at that same time. And when I got admitted, I was right around 5 centimeters and had a really easy time for quite a while. My husband and I actually ended up playing cards for most of that time. Right. Yeah. And so around 8:00 after I had gotten the 2 doses of ampicillin, they were able to break my water. And I was at about 6 centimeters when they broke my water, and things just got so intense so fast. Literally within 90 seconds of them breaking my water, I was having 90-second contractions, 90 seconds apart, and they were frequently doubling up, which I think is because of the Pitocin. I think is at least how I understood it, that was a possibility. So just really intense, really fast. And in my head, like I said, we didn't really have a birth plan by any means, but we had done a lot of thinking about different positions and being on the ball and being in the tub and all of that. And terminally, I could only get comfortable in essentially one single position and did not want to move at all once I got relatively comfortable.
Interesting. What position was that? I'm just curious.
Kind of like I think they called it like a Buddha position almost. Like they raised the back of the bed really high upright. So I was sitting upright and then put my legs down beneath me.
Yep.
And that seemed to at least work for me for a while. And then around, I don't know, maybe 10 p.m. or so, they checked me again. I was 7 or 8 centimeters. I don't remember exactly, but I started shaking like almost uncontrollably, just really, really bad shaking. And the nurse suggested that I try the tub, which I did maybe for 15 minutes. And again, just couldn't get comfortable in the tub. So went back to that one position I was comfortable in, but at that time, requested a dose of fentanyl.
Okay.
And that was, hugely helpful for me. Not that it took away all of the pain, but that it just really allowed me to kind of dissociate from the pain and focus on my breathing and really just sort of turn inward, which was what I knew I needed to do if I was going to do it without an epidural. Right. So was able to just really focus and also at some point started falling asleep between my contractions, which I don't know how you can fall asleep in 90 seconds, but I definitely did. And it was helpful because at that point, pain is exhausting in a way. And so I was getting very tired. So the fentanyl started to wear off. I knew at that point, they were like, you're pretty far along. We don't feel comfortable giving you another dose. Yeah. So I requested to do the nitrous oxide, which again, didn't really help with the pain, but just helped me dissociate. And I was able to use that while I sort of, breathed through the contractions. And that was helpful to me. And maybe around midnight, I was 100% ready to tap out, get an epidural. Because like I just said, I was exhausted. Right. And thought that at least with an epidural, I could sleep for a while, recuperate, and then have the energy to push. And so she checked me. And of course, I was at 9.5 centimeters. And she was like, we don't really have any options at this point. Which was good though, because I had at that point, really developed the urge to push. and was motivated to push for sure. And as soon as I started pushing, I think a lot of women have that sensation that it really feels good to push. So in a way was kind of thankful for that, and pushed for about an hour, which again, very, very intense, and got, close to the end when she was crowning, and they had me hold her while she was crowning for a good 3 contractions, I think, if I remember it correctly. And that was very, very intense. The ring of fire is undoubtedly a real sensation. And after that, 1 push to get her head out, and, 1 push to get her shoulders out. And unfortunately, we later learned that she was in like the 80th percentile for head circumference. So I did still end up with a grade 3 tear, but overall, it went pretty well.
Gotcha. As a fellow, I had C-sections, but as a fellow mother of children with big heads my children's heads were always in the 95th percentile. So I understand.
Yeah.
All righty.
Yep.
So lots of things come up when I think about how, your experience. It's interesting that were they offering you the options of like, do you want some IV medicine, or do you want some nitrous oxide? Or did you tell them like, I will tell you what I want, so don't ask and I'll let you know?
It was very much that way. Like I had, done all the research about the fentanyl and about the nitrous, so knew that there was going to be a point that I would probably want one or both of them.
Gotcha.
The nurse, we had a fantastic nurse, and she was very instrumental in just helping me find that position to get comfortable in, and just helping me breathe through the contractions. And when I started shaking uncontrollably, she was really right there, just trying to help me figure out how I could get through that. And so I asked for the drugs, but she was very helpful with everything else.
Gotcha. And then did you have a midwife? Were midwives caring for you, or was it physicians?
Correct. It ended up being a midwife. The physicians in that practice, really only come in for C-sections and those kind of things, but the midwives do most of the deliveries.
Okay, so. Yeah, I just recently, at the time we're recording this, I did a podcast episode on midwifery, and that is a model that some practices adopt, where the midwives literally do most of the vaginal births, and physicians only do C-sections or operative vaginal deliveries.
Yeah, that's how it is.
Yeah, during the time, as things were ramping up, were they still increasing the Pitocin, or was it like, what were they doing with the Pitocin?
No, they were definitely increasing the Pitocin. And I remember asking the nurse at one point, right around 7 or 8 centimeters, like, can we turn it down?
Right.
Can we turn it off?
Like,
stop. And she was like, no, we really can't. And I remember being pretty disheartened by that. But I think, and that was right when I started, like, okay, then I need some drugs.
Gotcha.
Yeah.
Because it was just really intense.
It was very intense.
Yeah.
Yes.
Yeah. And also, it sounds like you had. I think that the beauty is that you had all of these options that you knew in your tool bag, but in the end, it was like a couple of things that really worked well for you.
Absolutely. Yeah. I feel like I had done, all of the research, and like I said, listened to enough podcasts and read enough, that I definitely had a full toolbox, and was pretty surprised, I think, by the fact that I only ended up, in one position, without a doubt.
Right. And what was your husband doing during all of this time?
He was there with me the whole time, and very supportive, but I undoubtedly very much turned inward, and feel like I was very much, in a way, not in that room mentally. So I know he was there right at the very end of labor, before they let me push. He was incredibly helpful with those, last few minutes of contractions. I remember just like staring into his eyes, because it was like the only thing I could do to not think about how much pain I was in. And then while I was pushing, he was super helpful right there. I'm sure he had a couple broken fingers or a bruised hand after I was done, just because I was squeezing his so hard. Right. But he was super helpful.
Love it. So you say you ended up with third degree tear, it sounds like, and you
Correct.
didn't have an epidural. So, and let me back up and say, I presume they did skin to skin contact and,
Absolutely.
yeah.
Yep.
Yes. So, when it was time to get that repair fixed, what did they do for you for pain management?
It's a great question. It was interesting. They were using, obviously topical lidocaine to try to numb the area, but it wasn't working for me really at all. And I felt most of quite a few stitches go in. So they let me continue to use the nitrous oxide, which I would say was kind of helpful. But I still felt quite a bit of it. And looking back, it was actually kind of sad because I don't really remember a lot of those first moments with my baby because of the nitrous. I was it makes you feel drunk.
Sure.
And I just don't remember those very, very precious moments that well. So that was maybe the one part of my birth experience that I was not upset about, but just a little sad about.
Yeah, 100%. I can totally understand that. That's one of the things that I know on my side is frustrating is when someone doesn't have an epidural and then they need stitches afterwards, making sure that they're comfortable during the procedure can be tricky sometimes. So yeah, I totally see how that unfolded for you, but hopefully it didn't take too terribly long and you were able to get started with being a mother fairly quickly.
Yeah. Again, I don't really remember that well, but let's hope it was that way.
Yeah. So then what has the postpartum period been like for you?
It's been a challenge for sure. In delivery, I also ended up dislocating my tailbone.
Oh,
so
how did you figure that out?
I don't know. Like I was, my tailbone hurt immensely. Like within a couple hours of delivery, it was very, very hard for me to ambulate. And one of the midwives came and just sort of pushed on my bones at that point and just sort of made that suspected diagnosis that's what had happened. She said, I don't think you broke it, but there's a very good chance that you dislocated it or, severely bruised it, whatever it was.
Oh.
But I was in quite a bit of pain from that. And literally it would take me 5 minutes to get out of bed because I had to move so slowly. So that was, hard as a new mother. But then also Sloan had high bilirubin levels. So she needed to be under the bilirubin lights for 3 days. So we were in the hospital for, an extra day.
Right.
And that's just really hard to see your baby in a little box, over in the corner of your room and that you can't really cuddle and hang out with them. So that was tough. I definitely had some baby blues from about 3 to 6 weeks. And was able to get through that, but it's for sure a real thing. Just had a hard time bonding, I think. And then at one point it totally lifted and it clicked, but there was a tough time there for sure. And then also at around 3 weeks, just had this very strange sensation that like something was falling out, and went to my provider and got diagnosed with bladder prolapse. So have been dealing with that now too, but was able to start pelvic floor physical therapy around 8 weeks. And that's been hugely helpful. I would recommend that every pregnant woman, prolapse or not, go to pelvic floor PT. It's amazing.
We don't recommend it enough at all. And they do like magic for sure.
Yeah.
So, I mean, you actually had a lot going on. I mean, it sounds like you managed it pretty well, but I'm guessing in the moment that was difficult. Like, how did you, like the tailbone issue, did it just get better slowly? I mean, that's a big setback potentially right after birth.
It really was. I have some good friends who are massage therapists, so kind of asked them their recommendations, and they gave me some suggestions for stretches and just sort of movements that I could do, like really shallow squats almost, that I could do to just sort of gently kind of work it back into place. So that, and around the clock ibuprofen for like a solid 3 weeks, and eventually got through it.
Gotcha. Now, do you feel like you had support and guidance from the healthcare system in terms of helping you navigate these things in the postpartum period?
Not enough. And I really wish that postpartum education was more a part of prenatal care. It's just never mentioned that those sort of things can happen. I think, I had no idea that bladder prolapse was even a possibility. And I think it would have been nice to at least know that. And once it got diagnosed, my midwife was, very helpful and, recommended PT and all of that. But
yes, for sure. I mean, I've learned this from a colleague, and I've said this, many times, is that it's like the woman is like this wrapper carrying the sweet candy, and once the candy's out, we kind of toss the wrapper away after pregnancy is over. And we need to realize that we need to look after moms as well, because in order for baby to be healthy, mom has to be healthy also and be able to take care of that brand new human being. But yeah, we definitely need to do it starting in the prenatal period. I had a psychologist on the podcast last year, and or maybe it was the year before that. Anyway, she thought we should start talking about it at 28 weeks, like in the third trimester, start preparing for postpartum. And I agree. We do need to do that more.
I absolutely do too.
Yeah. Yeah. And then, so did they see you at a typical 6-week checkup if you hadn't otherwise have called to make an appointment earlier?
Correct. That was all that was initially scheduled, was the 6 week. And then, I had called around 3 weeks.
Yeah, I think that's just not adequate, especially after your first baby. I think we're getting better about checking in on folks sooner, but 6 weeks is just, a lot happens in those first 6 weeks.
Oh my gosh, it's crazy.
Yeah. So looking back on things, how do you feel about your birth experience?
Like I said, I thought that I felt very empowered, just to start off, that I was able to do it. I was, proud of myself.
Absolutely.
But like I had mentioned, was just a little bit sad that I don't have great memories of those, first maybe 2 hours after she was born. I remember, them calling out that she was a girl. We didn't know the gender. And, and I remember, them putting her on my chest, but then after that, it's really a blur. So, that I do wish I had, just been more a part of. And that, and really just like we were just talking about, that I wish I had, known about some of the postpartum complications, beyond depression and hemorrhage.
Yeah. There's definitely more to it than that. Do you feel like, it sounds like you had friends you were able to lean on in the postpartum period, or community? Do you feel like community was a part of helping you get through that sort of postpartum piece?
I mean, you obviously have children, and understand that, that newborn phase, those first 6 weeks, you're pretty isolated. So, you're just at home, you're just with that baby. And I saw my friends, but maybe not enough. My husband was home for maybe 3 weeks after Sloan was born. And so I don't know if I had great support in the postpartum period. My mom came for 2 weeks, and that was super helpful. And my dad lives not too far away, and so he would come over and help out with Sloan. But maybe I just didn't talk about it enough. I am now, but maybe could have used a little bit more support, actually.
Yeah, it's hard. It's definitely hard. And when you look back on it, I know for me, when my first one, who was a preemie, I was a hot mess. It's in that first month. So I think we're getting better about creating even online communities or things like that, where people can reach out and know that, like you said, the bonding piece, it doesn't always happen immediately, that you're just in love with this. And I'm not trying to project on you. I'm just saying in general, that you're in love with this person. Sometimes it takes a bit, they're new, you're new. It just takes a little bit to get all of those things connected.
Yeah, without a doubt. And that's exactly how I felt.
Yeah. So just to wrap up, what is your one favorite piece of advice that you would tell other women as they get ready for their birth?
Sure. It's kind of a multifactorial, I guess. But that during pregnancy, deliver, and in the postpartum period, I would just say, if your body is telling you something, listen to it. Your body, and don't ignore it. Don't worry about bothering your provider or bothering your support system. Get help when you need it. And then also, just realize that maybe the plan that you have in your head, or the positions that you think you're going to be comfortable in may not always work. But at the end of the day, lean on your nurse and your midwife and your support system just for help in those moments. And that, all the ways that babies make it into this world are amazing and beautiful.
Oh my goodness. That is just lovely, lovely, lovely. Perfect way to end. Perfect way to end. So I don't know if you're on social media or anything at all. I always offer people the option. Are you on social media or open to connect? It's totally fine if you say no.
No, I would be happy to. Maybe not on social media, but just via email, alexefrederick@gmail.com. I would love to, chat with other moms because I know that would have been very helpful for me. Yeah. So yes, feel free to reach out.
Love it. Well, thank you so much for that. Well, thank you, Alex, so much for agreeing to come onto the podcast and sharing your story. It was really, really helpful.
Thank you. Thank you again for having me.
All right. Wasn't that a great episode? Thank you so much, Alex, for agreeing to come on and share your birth story. Now, after every episode where I have a guest on, I do something called Nicole's Notes, where I talk about my top takeaways and thoughts from the episode. Here are my Nicole's Notes from my conversation with Alex. Number one, Alex had the benefit of a supportive work environment when she was dealing with the exposure to the chemotherapy medications, and that is fantastic. But unfortunately, a lot of women find themselves in circumstances where they are not supported during their pregnancy and work, and where they are discriminated against as they are pregnant. This can often be the case in lower paying jobs. Now, I unfortunately don't have a lot of great information and help necessarily to pass along about how to manage that, but I want to make you aware of it. And if you are listening and you have some great resources, then definitely shoot them my way, whether it's a DM on Instagram or you can email me through my website, drnicolerankins.com. But be mindful of that. And sometimes you just have to be careful. But I do want you to know that there are legal protections in place. There's the Pregnancy Discrimination Act. FMLA has some protections in place for pregnant folks and not being discriminated against. So do know that you have those legal protections in place. The problem is sometimes it can be difficult to activate them because of the timing and things like that. And I don't want to scare you or make you worried, but I do want to make you aware of those realities so you can be prepared just in case. Okay. Point number 2 from my Nicole's Notes is that you do not know what pain management options will work until you try. Okay. You need to have lots of tools in your tool bag. Alex mentioned how one particular position of sitting up is what really worked for her to help her manage pain. And honestly, you really just don't know until you try. The key is really educating yourself so you have different options available to you. Childbirth education makes that process a lot easier, especially when it's great childbirth education like the birth preparation course. It consolidates everything together for you so you don't have to go looking through multiple different sources. You can just head to the birth preparation course. I have tons of information in there about all your options for managing pain, unmedicated birth, epidurals, IV pain medication, nitrous oxide, all of it is there. And of course, there's tons of great information about labor, birth, postpartum education too. You can check out all the details of the birth preparation course at drnicolerankins.com/enroll. It is incredibly affordable for everything you get in the course. And the third thing that I want to say is just a reminder to listen to your body. I am an expert in what I do. I've been doing this for a long time, 15 years, and I'm an expert in helping babies come into this world, but I am not an expert on you and your body. You are, okay? Remember that and bring that knowledge into your relationships and your encounters, that you're an expert on what's going on in your body. So be sure that you listen to your body and those signals that it sends you and communicate that. And remember that you're an expert for you. All right. So there you have it. Be sure to subscribe to the podcast wherever you're listening to me right now. And I'd love it if you leave a review in Apple Podcast. I do shout outs from those reviews and they help the show to grow. Also, do check out that brand new quiz, the labor pain quiz. It's drnicolerankins.com/quiz and let me know what you think about that. So that is it for this episode. Do come on back next week. And until then, I wish you a beautiful pregnancy and birth. Thanks so much for listening to this episode of the All About Pregnancy and Birth podcast. Head to my website, drnicolerankins.com, to get even more great information, including free downloadable resources on how to manage pain and labor and warning signs to look out for after birth. You'll also find information on my free online class on how to make a birth plan that works, as well as everything you need to know about my signature online childbirth education class, the Birth Preparation Course. Again, that's drnicolerankins.com, and I will see you next week.
Time is precious, and so are our pets. So time with our pets is extra precious. That's why we started Dutch. Dutch provides 24/7 access to licensed vets, with unlimited virtual visits and follow-ups for up to 5 pets. You can message a vet at any time and schedule a video visit the same day. Our vets can even prescribe medication for many ailments, and shipping is always free. With Dutch, you'll get more time with your pets and year-round peace of mind when it comes to their vet care.